In this podcast episode, Staci Whitman, a functional dentist, shares her insights on oral health, emphasizing the importance of understanding the connection between oral hygiene, diet, and overall health. The discussion covers a wide range of topics, including the impact of certain foods and drinks on dental health, the role of fluoride, and practical strategies for reversing cavities, eliminating plaque, and repairing receding gum lines. Whitman begins by highlighting the common misconception that sugary foods and drinks are the primary culprits behind cavities. While sugar does play a role, she points out that many seemingly healthy snacks, such as chips, crackers, and granola bars, can be just as damaging due to their high carbohydrate content and the frequency with which they are consumed. These foods can create an acidic environment in the mouth, leading to demineralization of the teeth. To combat this, Whitman recommends a structured eating schedule, ideally every 2 hours, to allow the mouth time to remineralize. This involves consuming a balanced diet rich in proteins, fruits, and vegetables, while minimizing the intake of fermentable carbohydrates. She emphasizes the importance of hydration, suggesting that drinking water after consuming acidic or sugary foods can help neutralize the mouth's pH. Whitman discusses several strategies to maintain oral health, particularly after consuming foods that may contribute to cavities. Chewing xylitol gum or mints can be beneficial, as xylitol has been shown to inhibit the growth of harmful bacteria in the mouth. Additionally, consuming crunchy fruits and vegetables, such as apples and carrots, can help dislodge food particles and stimulate saliva production, which is crucial for remineralization. Another key point is the timing of brushing teeth. Whitman advises waiting at least 30 to 40 minutes after eating before brushing, as the enamel may be temporarily weakened by acidity. Instead, she suggests rinsing with water or using a baking soda solution to help neutralize the mouth's pH. Whitman emphasizes the critical role of saliva in oral health. Saliva contains minerals that help remineralize teeth and maintain a balanced pH. Factors such as diet, hydration, and breathing patterns can significantly affect salivary health. Mouth breathing, for instance, can lead to dry mouth, which increases the risk of cavities and gum disease. The oral microbiome is another focal point of the discussion. Whitman explains that a healthy balance of bacteria in the mouth is essential for preventing oral diseases. Disruption of this balance, known as dysbiosis, can lead to issues such as cavities and gum disease. She advocates for the use of prebiotics and probiotics to support a healthy oral microbiome, suggesting that fermented foods can be particularly beneficial. The podcast delves into the topic of cavities, with Whitman explaining that they can be arrested or even reversed if caught early enough. She discusses the use of hydroxyapatite, a mineral that makes up tooth enamel, as a natural alternative to fluoride for remineralization. Hydroxyapatite can help reduce sensitivity and strengthen enamel, making it a valuable tool in cavity prevention. Whitman also addresses gum recession, which can be caused by factors such as aggressive brushing, misaligned bites, and certain bacterial infections. While gum tissue cannot regenerate, Whitman emphasizes the importance of maintaining gum health through proper hygiene, nutrition, and regular dental checkups. She encourages patients to be proactive in their oral care and to seek out functional dentists who can provide personalized treatment plans. Fluoride is a contentious topic in dentistry, and Whitman shares her perspective on its use. While fluoride can help prevent cavities when applied topically, she raises concerns about its systemic effects, particularly in vulnerable populations such as pregnant women and young children. Whitman points out that fluoride is not an essential nutrient and that its safety has not been thoroughly established. She advocates for a more cautious approach to fluoride, suggesting that individuals should consider alternatives like hydroxyapatite for cavity prevention. Whitman emphasizes the importance of understanding the risks and benefits of fluoride, particularly in the context of water fluoridation, which has been linked to various health concerns. Throughout the podcast, Whitman underscores the connection between oral health and systemic health. Poor oral hygiene can lead to conditions such as cardiovascular disease, diabetes, and even Alzheimer's disease. The bacteria in the mouth can enter the bloodstream, potentially causing inflammation and contributing to chronic health issues. Whitman encourages listeners to take their oral health seriously, as it can have far-reaching implications for overall well-being. She emphasizes the importance of regular dental visits, a balanced diet, and maintaining a healthy oral microbiome to prevent disease and promote optimal health. In summary, Staci Whitman's insights provide a comprehensive understanding of how to reverse cavities, eliminate plaque, and repair receding gum lines. By focusing on diet, oral hygiene, and the health of the oral microbiome, individuals can take proactive steps to improve their dental health. Whitman's emphasis on the importance of personalized care and the need for a holistic approach to dentistry serves as a valuable reminder for anyone looking to enhance their oral health and overall well-being.